I'm here today with Rick Peng from Memorial Sloan Kettering Cancer Center. Rick, you are a presenter at today's Innovator Summit. Tell us a little bit about what you were talking about and how your message was received.
Yeah, so at Memorial Sloan Kettering Cancer Center, I lead the MSK Innovation Hub, which is our program through which we identify opportunities to work with innovators in the digital health space, specifically earlier stage companies who are doing new things with new technologies to serve unmet needs of cancer patients and cancer researchers. So in my talk, I just covered, one, the motivation behind our program, the need for this type of collaboration across the innovation ecosystem, and two, how we go about it with our different programs. We offer programs for forming collaborations between individual companies and Memorial Sloan Kettering cancer experts, whether they're clinicians, researchers, technologists, and then also our newly launched cohort-based accelerator program, the MSK Hub Challenge, where we bring in a cohort of companies that are similarly aligned on a single problem that we specify prior to selection of the cohort. We bring these companies together to work on forming ideas around how they might collaborate with Memorial Sloan Kettering to solve unmet needs within this specific problem area together. So I think the talk went over very well. I was on time.
Which is really important at a big conference like this.
Yeah, I mean, I got a lot of great follow-ups afterwards of folks who are interested in potentially working with us, or folks who are connected to Memorial Sloan Kettering in some way. So really excited and thankful for this opportunity to be here with HITLAB and with the community here.
So tell me, where are the biggest challenges in cancer care as you start to navigate some of this new technology that's coming pretty fast and furious right now?
Yeah, so I think there's a plethora of different opportunity areas, both in clinical care and research. In clinical care, it's always about striking the right balance with technology, introducing things in a way that fits the workflows and of clinicians and the hospital staff, while also making sure that their own needs in terms of adopting technology are met. In the research space, it's all about how do we apply the latest and greatest technologies, including AI, to discovering things like new drugs. And ultimately, I think the key opportunity here is really around finding good matches between the technologies that exist, the solutions that companies have built or are building, which you can think of as hammers, and the specific vetted opportunities and actual unmet needs that a cancer center like MSK is very familiar with, and you can think of those as nails. And so it's this exercise of making sure that you match the right hammer, the right tools to the right nails, the right opportunities. The innovation doesn't have impact unless there's a good match between those and you bring them together. So the MSK Innovation Hub program is ultimately about finding both of these sides and bringing them together in impactful collaborations that produce technologies applied in ways that actually make an impact in how we treat cancer.
Right, but you're also running a business.
Yep.
And you need to be able to make some money, and it's sometimes can be a delicate balance, especially when you're projecting ahead in a somewhat uncertain future.
Yeah. So yeah, I think the finances and the commercial side of everything is always a key consideration in all this. One of our core beliefs in terms of how we collaborate with industry is, MSK is, first and foremost, an academic medical center that has innovation, research, and leadership in science and technology in the core of its DNA. But ultimately, the way that we can maximize the impact of novelties and advances in science and technology is to deploy them at a commercial scale. And MSK is not always in a position as a not-for-profit organization to do this, and so ultimately we really lean on our partnerships with with industry and with companies outside of our four walls to work with us to translate not only our ideas but also their ideas, amplify them in ways that bring impact to patients, not only in isolated situations and use cases, but ultimately at scale.
So when you look out at the health IT landscape as it exists right now, what are you most excited about?
Wow, that's a loaded question because there's so many opportunities. I mean, I mean, I think in cancer care especially, there's this paradigm of precision medicine. How do we continue to tailor, the latest treatments to each individual patient based on, who they are as an individual, based on their medical history, based on their, genomics testing. So I think, we're definitely at an inflection point in terms of the availability of the technologies that generate this information and our ability to translate that information into insights that we can bring to clinicians, bring to oncologists to better inform decisions around what's the best treatment that's going to work for each individual patient. And this is also being reflected in how new drugs are also being brought to market in the biopharma space as well. So I think AI is definitely an easy answer to throw out there these days, but I think it's definitely being applied in really meaningful ways in the cancer care and cancer research space.
Innovations are great, but really this is about speeding up care to people who really need it. Cancer is a nasty, ugly, unforgivable beast, and then taking those innovations and using them to improve patient outcomes. It sounds simple when you boil it down, because we know that there are many different tentacles in this, and it's a big layered system, and it seems like we're trying to do our best to get back to the old way of doing medicine, if that makes sense, where it's really just much more simple and much more doctor-patient centered.
Yeah, and I think ideally, our goal is not to make the entire experience all about the technology. It's more about using the technology to reduce the friction in that clinician to patient experience. And we think about this not only in terms of how technologies like digital can serve patients when they're when they enter our doors and we are visiting their oncologist, but also how do we bring those technologies to patients to help keep in touch with them when they're at home between visits. We think about how we might be able to support applying these types of technologies to patients before they even know they have cancer, to make sure they get referred to screening and diagnosis services in a timely manner. Think about it in terms of how do we apply this to patients after they're done receiving treatment, once they're in post-treatment survivorship. We think about how do we bring these technologies to better engage different members of each patient's life, including their caregivers and family. So I think there's certainly a lot of different opportunities. I think Memorial Sloan Kettering is always thinking about how can we best support the full spectrum of each cancer patient's journey and everything that really contributes to their overall care and their overall experience in healthcare.
Yeah, eventually cancer affects all of us, in one way or another. And I think a lot of people are rooting for the work that you do and your colleagues. And we just wish you all the best and hope that you can come back in 6 months and continue to report good news.
Yeah, I hope so as well. Thanks.
Thank you.
Thank you.